Hi, my name is Dr. Jenny Liu, and welcome to my YouTube channel. I'm a board-certified dermatologist in Minneapolis, and I love to talk about all things skin and skincare related. On this channel, I'll plan to educate you on various skin conditions, share my knowledge about skincare, and talk about skincare products and skincare product reviews. You can follow me on my Instagram handle at derm.talk, as well as TikTok at Dr. Jenny Liu. But first, I want to share with you guys a little bit about myself. Why did I decide to become a dermatologist? I've always loved working with my hands. I enjoy procedures very much, and I actually toyed around with the idea of general surgery. However, I found in third year medical school the schedules were very taxing, and ultimately stumbled across dermatology later on in third year medical school when I volunteered at a free clinic, and I just really enjoyed that visual aspect of dermatology. In my mind, dermatology is what kind of encompasses medicine, or what I envision medicine to be. In the sense, you can visualize the pathology, treat it, and visualize the improvement that you get with treatment. And to me, that is very satisfying and gratifying. I love the diversity in dermatology as a specialty. You're able to do a lot of procedures, work with your hands, which is what I enjoy, but also there's a lot of complex medicine in dermatology that most people don't appreciate. On social media, we see a lot of the skincare and cosmetic side, but dermatology, there's a lot of medicine in it. I am an assistant professor, and I train and work with residents and medical students. I also take inpatient call. So I, along with my colleagues, see a lot of the really sick patients that are admitted for their complex skin conditions. And I also enjoy the fact that there's a lot of other variety in dermatology, including patch allergy, occupational dermatology, pediatric dermatology, there's procedural dermatology, as well as dermatopathology. Now, I don't practice all of that. Those are additional fellowships that you can pursue after training. I mostly practice general dermatology, but even as a general dermatologist, I really enjoy the variety. In my day-to-day, I do a little bit of general medicine, procedures, cosmetics, and I also really love working with residents and medical education. I have quite a few conditions I really enjoy treating, but if I had to pick one, it would be dermatosis papulosa nigra. And these are benign age spots or growth that we often see in ethnic skin. And if you zoom in on my face, you probably can appreciate some of these bumpies on my cheeks that really popped up throughout pregnancy for me. And these are just benign age spots that we often get. All of us can get them on our body, and on their body they're called seborrheic keratosis, but on the face of ethnic skin they can be quite bothersome cosmetically. The reason why I enjoy treating them, because it's fun to treat, and also I find that it brings patients a lot of satisfaction, and it's fairly easy to do. The best treatment is just use a little electric needle, we call cautery, and literally buzz them away. And as you're literally using that needle on contact with the skin, you can see that top growth literally just melt away. And so it's really fun and very satisfying. So I was born in Beijing, and I moved to Minneapolis at the age of 8, and pretty much have moved around the state of Minnesota throughout my life, and eventually settled in Minnetonka with my parents in high school. And I think that's one reason that drew me to my husband. We both were born in China and moved to the US. He moved to Milwaukee around the same age, and so we kind of really gravitated towards each other because of our similar experiences growing up as a first generation Chinese American. So I went to undergrad at UW-Madison, and I ended up staying for medical school mostly because my husband, who I started dating at the end of senior year, we both got into the same medical school, and a lot of my friends got in, so I just ended up staying. I actually wanted to be really close to home, and so that worked out really well. In essence, I've been a Midwest girl all my life. And then for residency, I came back home to the University of Minnesota. Again, I really wanted to be close to my parents, and it was my number one choice. So I was really fortunate to match at my top choice for residency. And I have been practicing in Minneapolis since residency. So my husband is a ear, nose, and throat, so ENT surgeon. The funny story about us, I met him the very first day of undergrad. We had all the science courses together, literally in the exact same class. And I knew him freshman year, but didn't really get to know him until third and fourth year of undergrad when we both realized we were applying to medical school. And I think just the camaraderie of applying to medical school and that nervousness really brought us together. So my husband and I've known him for half of my life, believe it or not, but we've been married almost 10 years. And we have a 3-year-old daughter who's the joy of our lives, but she is super rambunctious and crazy, and trying to parent with another MD spouse during this pandemic and trying to work at the same time has been definitely a huge challenge. So I really appreciate and can't imagine all the stay-at-home moms that basically do this as a full-time job. My social media has essentially become my biggest hobby. I started this as a hobby to really help me de-stress. And I've always wanted to start an Instagram account, mostly just to showcase a new side of dermatology, different side, being a female in academics and being a female in administrative leadership. And throughout the years, the 5 years that I've been on social media, it has now evolved to something that I had never imagined that it would become, and has now become a hobby of mine. I'm constantly sharing information, knowledge about, dermatology, skincare products, but it also showcases little tidbits of my life. Aside from social media, I love to travel. Before the pandemic, my husband and I did a lot of traveling, and we hope to do that as our daughter gets older. And then one of the other things I really enjoy doing is cooking for my family. For those that have followed me on social media, I share little tidbits of my cooking skills on my Instagram stories. And so that's the other thing I really love to do, is to cook. And this is Sophia, who has decided to join us. Can you look at the camera, honey, and say hi? So my daughter just decided to join the video, guys. Sorry. She was making a fuss downstairs, so I couldn't record. What is your name?
Sophia.
And how old are you?
3.
You are 3 years old. Is Mama a dermatologist?
Mama dermatologist.
So one of the reasons I love being a dermatologist is just how people feel better about themselves. Our skin is one of the first things that we see when we encounter another individual. A lot of the conditions like eczema, psoriasis, acne that we commonly treat as a dermatologist can really affect one's self-esteem. I really love the fact that I'm able to treat these patients and improve their skin. Visually, the patients are able to see that, and they really feel better about themselves when they're properly treated. So that's a little bit about me, but I would love to hear from you what topics you would like me to discuss. Comment below with questions and topic ideas, and make sure to give this video a thumbs up, and please subscribe to my channel, and don't forget to follow me on Instagram at derm.talk. I'll see you guys next time. Bye. Say bye.
Make sure to subscribe. Why you say bye?